My name is Kyle. I'm a general practice veterinarian with a special interest in orthopedics, and I also have a minor interest in neurology as well. Day to day, I spend most of my time doing the small animal side of things, but it is very nice to be able to get out on a nice sunny day and go and see a horse or a sheep. So being a mixed practice grants you that opportunity, which other small animal practices or large animal practices simply would not. It's very rare that these days that you get a mixed practice that even has mixed vets. Most mixed practices have small animal vets and large animal vets. The vets don't often cross over anymore. So that is a very nice aspect of working at the clinic. On a day-to-day basis, there's a very nice balance between surgeries, consults, and workups. I mean, some days are more manic than others, but in general, the balance of types of work that you do during the day is quite good. Ideal day will involve workups of animals that have mobility issues. Those can be orthopedic related, they can also be neurological in origin, hence the connection between the two is very important. When it comes to orthopedics, I have done a fairly intense additional training, both theoretical and practical, in terms of orthopedic surgery, allowing us to offer those services to the public and to animals that need it, rather than needing a referral to our nearest referral centre in Bristol. In that case, I think it's a very important service that we offer. The practice has invested in a fairly hefty portion of equipment required to do general orthopedic surgery, including specialised drilling equipment and pins and plates and that sort of thing. The practice also has a wonderful digital X-ray suite, which allows you to not only just take a normal X-ray, but to do measurements and that sort of thing on the X-rays themselves on the computer, so that you can correctly size your implants if necessary. So in terms of conditions that we're able to manage from an orthopedics point of view, there are your bog standard hit by car fractures. Those can be surgically repaired. We have the imaging required and the equipment required to do that. So just about any fracture can be managed in the clinic. We're also equipped to manage cruciate ligament ruptures. We're equipped to manage luxating patellas, hip dislocations, and other dislocations of other joints. We've performed a pancarpal arthrodesis on a dog that had such severe osteoarthritis in his joint that his joint was essentially collapsing and unable to support itself. If you're unsure if your animal needs orthopedic care, the simplest solution is just come in for a consultation. But the fact is, if you are suspecting that it might need orthopedic care, it probably does.